Hi again, this is Dr. Habib. So today we're going to do more Q&A, more rapid fire. And the first question is from Mohammed Nasir. He asks, how do I maintain muscle mass and lose fat at the same time? I have a simple answer for you: intermittent fasting. A couple of real good reasons for that. Number one is that as you intermittently fast, without the source of carbohydrate, your body's going to burn the fat as the source of fuel. Number two, when you are intermittently fasting, your body generates amino acids to maintain the lean body mass. That is your answer: intermittent fasting. Question is, how long to fast for? We talk about between 14 and 20 hours. 14 is quite easy, 20 hours gets a little bit harder, but maintaining fluid intake is the key to intermittent fasting. That's the best way to maintain muscle whilst losing fat. This one's from Celestial Hassana, my good friend. He describes, how do I maintain muscle mass as I'm getting older? So what I would say is, let me give you a range. And the number I want you to think about is below the age of 40, and between 40 and 60 years of age, and above 60. So if you're not quite 40, which I suspect you're not, this doesn't quite apply. And then the next thing I'm going to discuss will. If you're less than 40, you need more amino acids as you're building, and it's called anabolic. Between 40 and 60, taking too much protein, too many amino acids, turn on the aging process, the signal for aging. When you get above 60, you need increased amino acids to maintain muscle mass and conducive to longevity and good health. So if you're a young person suffering from these symptoms, then a few things might be going on. An imbalance in the hormones. One of the concepts we describe is aromatization. In other words, your testosterone may be converted to estrogen. And it happens when you drink too much coffee. It happens when you're exposed to hand soap. It can happen when you have too much body fat, right? And if it's not the hormones, then you have to look at deep inside. Is it the gut and inflammation? Those could stop your body from building up. Inflammation is damaging, it breaks you down, okay? So those are the simple answers to maintaining lean body mass as you get older. It's Saidi, and she describes poor circulation in the lower leg. You have to divide it by age and gender, by venous or arterial. So with veins, it tends to be the females and the hormonal ears. Well, the short answer is put tight stockings on, walk to increase the circulation, and as I said, it's hormonal at its origin, and it's a weakening of the blood vessels that lead to varicose veins. For arterial, it's a different ballgame. It could be minor, like Raynaud's syndrome, which is a genetic predisposition to cold hands and feet. So when the hands and feet are exposed to the cold, the circulation clamps down as an exaggerated phenomena. By itself, it's not a problem. Only a problem when it's part of an autoimmune disorder like lupus or rheumatoid. And then you have many complications. If it's just purely arterial, then what we're saying is that we need to increase the nitric oxide. You can increase nitric oxide by eating the greens, having acid in your stomach, and exercising. When you release nitric oxide, you get increased blood flow. So eating right, exercising is the answer to arterial blood flow, particularly in the lower leg, but arteries go to the brain, arteries go to the heart and the kidneys. So arterial blood flow is actually very important when you're talking about blood vessel health and circulation, because bad circulation or poor arterial health leads to risk factors for heart attack and stroke.